TREAT-A-THON, Dr. Okafor Chidumeje, the Lupus Dei, the Lupus Dei, TREAT-A-THON. Hello viewers, my name still remains Dr. Okafor Chidumeje, the Chief Executive Officer of OurDrKing Foundation, the convener of TREAT-A-THON, a 240-hour Guinness World Record clinical event that's going to involve a series of clinical care to patients for not less than 240 hours stretch. For some time, most of my friends, fans, relatives, admirers, colleagues have been pondering on how I am planning to achieve this. In fact, most people that have seen my flyers have kept asking me why there is no date and venue now. Okay, so I just want to use this video to rest that case. Now, anything that has to do with the public has to start with planning. Of course, if you fail to plan, you will plan to fail. Now, when it comes to events like this, you will start with creating awareness. That is the first step in planning, and that's what I'm actually doing now. When you create awareness, the next thing that happens is you get sponsorship. That you get people who are interested in your work and are willing to sponsor. So that's what actually is happening now. I already have people that are gradually picking interest. Then with time we'll get sponsors. So when we get sponsors, you now go back to Guinness World Record and apply. You apply, you give them, they will give you the dates. You give them the venue, they give you the dates, because they have to also send their repertoire to monitor the event. So it has to be a day that will fit into them, fitting with them. So that is how it goes. So right now, we've been creating awareness. Those flyers you are seeing, where I've been begging everybody to keep sharing this. As you keep sharing it, people will keep picking interest. With time, we'll start getting sponsors. Now, the next question people ask is, how is this going to be? Is this going to be your normal clinical work? You come to work and you will not go again for the next 240 hours. Well, not exactly. So many, of course, anything that doesn't have critics, is not going to work. So we've had so many people criticizing it, asking whether this is even legal, asking whether this is not unprofessional, asking whether this is not unethical, and until, in fact, that is why I now want to rest this case too. What we are doing is very ethical, very legal, very professional. Look at how it's going to be. It's just going to be like another kind of medical outreach. Medical outreaches are public events. You've been to them, public events. Just I'll be the only doctor there. And then I'll have a venue, which may or might not be a hospital. If there's a general hospital that's willing to give me their facility as a venue, good. If my own facility where I work is willing to give me their facility as a venue, good. If they're not willing to give me as a facility, we can get a hall. If I have a facility functional facility, then it's a lot easier, because that means surgeries, scanning, the ultrasound scanning, radiology, side lab, all these things are part of my clinical work. Side lab, like just to test for minor things like HB, malaria, typhoid, all those glucose, all these on-site tests. All these things are going to be easier than the theater and the labor room. These are the things we need. But if we can't get a facility, we can get those things in ambulance. We have ambulances where you can do surgeries, cesarean section, minor surgeries. We have ambulances where you can also deliver a baby, take a baby and do minor vaginal repairs. So it's going to be like another big medical outreach that will last for not less than 240 hours. I'll keep updating you guys as questions keep coming in. I thank you all for your interest. The mere fact that you even read what I posted and you criticize shows you have lots of interest. If you do not have interest, you just jump and pass or overlook it. I also thank those who have been encouraging me in several ways. I also keep asking for sponsors. God bless you. I remain Dr. Okafor Chidumeje, CEO at OurDrKing Foundation. Remain blessed. TREAT-A-THON, the Lupus Dei.